Welcome back, viewers at home. You're joining me for quite a groundbreaking discussion with Wits School of Medical Medicine Comprehensive Women's Health Program. And for that, I have Professor Nasreen Mahomed, Academic Head of Wits Radiology, to share in with us in terms of how AI can feature in medicine with a focus on its potential for diagnosing cancer in women. Assalamu alaikum, Professor. Jazakallah so much for joining us tonight.
Walaikum salam. How are you?
Alhamdulillah, how are you, Professor?
Alhamdulillah.
Now, getting started on understanding all things AI and how it can be integrated in the space of medicine, could you tell us more about the diverse aspects of women's health that the program aims to address, from that of preventative care to treatment of chronic conditions?
Firstly, I'd like to say thank you so much for inviting me to the program. On the 18th of October, this coming Saturday, we are hosting the first Wits School of Clinical Medicine Comprehensive Women's Health. It's from 8 in the morning till 1:30 p.m. And essentially, the theme of this program is combining, um, integrating bone, body, and mind, the holistic view of women's health. Too often, health is seen through a fragmented lens. We treat bones in one clinic, the body, example, the heart, in the heart clinic, and the mind elsewhere. But women's health cannot and should not be divided into compartments. Women's lives, experiences, and challenges are interconnected, and so too must we approach this in healthcare for women. So we are combining bone health, body health, and mental health in a comprehensive program. What is It's actually vital to recognize how these three components are interconnected. Poor mental health can weaken the body. Chronic illness can erode the spirit, and fragile bones can take away independence and worsen depression. So, women's health is a cycle, every part affecting each other.
Hmm. And thank you so much, Doctor, for really highlighting the fact that, a fragmented structure really is concerning in that sense. And I think I want to find out, what would you say are the biggest, gaps in women's healthcare that you hope this event will help address?
So, actually, that's a very important question. Um, w- you know, Historically, there has always been a focus on, where funding is available. And essentially, it has been centered towards, the male gender. Um, if you look, the current gaps are research, diagnostic and access, data and technology gaps, the preventative care gap, funding and policy gaps. In essence, um, the we recognize that there is a significant lag in these elements, and as I said, because of prior narratives. But we need to understand that by addressing these gaps, we can actually then prioritize elements um, of women's health and prevent and change fragmentation into integration.
Hmm.
And, by addressing gaps together, we can build a better healthcare system that, every woman in South Africa would actually see value to, and that serves every woman at every stage of life.
Hmm. And just mentioning the fact that, looking at women's health historically, it has been, under researched and not necessarily prioritized, if I can say so. I want to find out from you, what do you see as the most compelling reasons for focusing on women's health now, and why is this, event so critical in advancing this movement?
Sure, thank you. So, this event is critical because it creates a platform to break the silence, to share knowledge, to also unite clinicians from different aspects of women's health. Example, radiologists, obstetrics and gynecologists, oncologists, psychiatrists, dermatologists. So often we all work in different, compartments. And when we have our congresses, it's usually focused on one element. And now by combining specialists from different fields, we create a unique opportunity. And the other important, aspect of this symposium is we have our current MEC of Health and Wellness, and she is a decision and policy maker in Gauteng. So it's so important to get the policy maker in that same symposium, because I think it highlights the need our common goal to prioritize women's health not as a niche field but as a cornerstone of global health.
Mm. And Doctor, Professor Nasreen, there's something that I would like to ask with regards to looking at the current state when we look at the health sector and seeing that there's this huge gap that exists. What of the conversation around, affordability and access based on, the costing that comes with, just getting a consulting, service, or just getting the medication, or just getting the treatment in that sense?
So, absolutely, that's a very good question. As you are aware, I work in the public sector that serves around 85% of the population, whereas the private sector just serves 15% of our population. So and yet our public sector is under resourced. So, like just an example, breast screening for cancer. If you look at international and guidelines, every woman above the age of 40 should have a screening mammogram. In South Africa, we don't have a national cancer screening program for breast, right? Mammograms. So, in the government sector, only if they are if the patients are referred for, from the clinic or peripheral hospital, then they would get a mammogram. But whereas in the private sector, because of resources available, medical aids actually pay for mammograms. So essentially, women have better access, easier access, and if you pick up something like breast cancer earlier, and this October is Breast Cancer Awareness Month, hence I was wearing the pink. Then the prognosis becomes much better. That's why we do mammograms at an early stage. But if you pick it up later, then the patients actually do much worse, because the prognosis in stage 3 and 4 of any cancer is much poorer.
Mm. And something that I mentioned in the intro around, integrating artificial intelligence in the space of medicine. Could you tell us in what ways can artificial intelligence really enhance accuracy, speed, and efficiency around cancer diagnosis for women?
So that's a really good question. So artificial intelligence has immense potential. It to transform a cancer diagnosis in women. It enhances accuracy, speed, and efficiency. Example: improve accuracy. Artificial intelligence algorithms can detect subtle patterns on imaging. Example: mammograms. The AI has been trained on maybe 10,000 different mammograms. So using that sort of memory, pattern recognition, it is able to identify really small lesions. If maybe the radiologist is working alone, then they don't need a second read. So you would have then, with AI, a color heat map generated, and the area of concern would be highlighted by the AI. But then I think also it's important to remember that we don't treat a photograph or a picture, we treat the person, right? So it's a combination of everything. Then the next thing, AI can enhance speed. It can look at thousands of images within a few minutes and highlight cases that actually need to be prioritized, or referred to a specialist, etc. Then it increases efficiency. So in medical systems, you don't have to automate repetitive tasks. such as image segmentation, measurements, data classification. And so clinicians, you can, have more time to make complex decisions, and more time to actually spend with patient interaction.
Mm.
AI also has this, ability for precision and personalization. So AI can integrate into imaging data with genomic, histopathologic, and clinical information to predict cancer subtypes, treatments, and prognosis. So there's this importance, a lot of emphasis has been put on precision medicine, tailoring therapy to individual biology of a woman's cancer. And then finally, equity in access in low income and rural areas, AI driven screening, for example, or AI driven teleradiology tools can bridge the gap in accessing patients to specialist clinicians and extending expert level analysis to underserved populations.
Hmm. And another thing, Professor, whenever we're having a conversation around artificial intelligence, it being integrated in the workforce and looking at South Africa, the biggest crisis amongst others is that of unemployment. The fear then comes to say, AI will then replace the human touch in the workspaces. I want to find out from you if you're able to elaborate for us in terms of what optimal partnership between AI and human expertise in the context of humans' health and cancer diagnosis.
Well, that's a great question. Thank you. So AI doesn't replace clinicians, other healthcare workers, etc. It actually empowers them by combining computational intelligence with human judgment and compassion. We can achieve earlier detection, better diagnosis, example in cancer, and ultimately better outcomes for patients. AI doesn't only involve cancer research. AI can be used in reproductive and maternal health. In mental health and emotional well-being, there's things such as AI-powered apps, chatbots that can provide early screening for anxiety, depression, postpartum mood disorders. There's natural language processing that can be used to detect emotional distress in clinical and digital interactions, promoting timely intervention. Chronic disease management. AI driven platforms can help conditions that, disproportionately affect women. Example, autoimmune diseases, uh, thyroid disorders, chronic pain diseases like fibromyalgia.
Hmm.
And finally, access to health equity. In underserved or remote areas, AI tools can bridge gaps in access to care by offering virtual triage, diagnostic support, and remote monitoring. And I think that can be game changing, where we just don't have resources for patients. So I
Professor,
think, in essence, AI offers a holistic approach to healthcare, one that shifts the focus away from illness to wellness, from
hmm.
late diagnosis to early prediction, and from fragmented care to personalized continuous support. It has the power to make women's health more equitable, precise, and compassionate, especially in under-resourced settings.
Hmm. Professor Chazakala, so much, for coming in and really enlightening us in terms of what the world will look like, rather the world of medicine would look like with the integration of artificial intelligence, especially for those, forgotten or rather marginalized communities, and really addressing the idea of access as well as equity access in South Africa when it comes to all spheres of healthcare or education in this sense. But Jazakala, Professor, for joining us.
Jazakallah so much.
Viewers at home, in case you missed the doctor mentioning the event details, certainly note that it will be taking place on the 18th of October on Saturday from 8:30 until 1 o'clock. The venue is the School of Public Health Resource Center and Auditorium, Wits Education Campus at 27th Street, Andrews Road, Parktown. Certainly do check out, the Wits page to see more details and find out more so that if this is something that speaks to you, you do not miss it. But for now, let's head over to a net break. We'll see you just after this.